This training will review the school-located influenza vaccination program's standing orders for the management of acute adverse reactions. All vaccinators and clinic managers must review, understand, and adhere to the Stop Flu at School program's standing orders for inactivated influenza vaccine, and the protocol for the management of acute adverse reactions to vaccines. Personnel administering vaccines, and clinic managers, must be aware that recipients may experience an adverse reaction following immunization, which can be life-threatening. Clinic managers need to be prepared to recognize and respond immediately and appropriately if an adverse reaction should occur. When assessing persons with possible adverse reactions post-vaccination, follow basic first aid and initial assessment procedures. Check their vital signs: airway, breathing, including both their respiratory rate and air movement, and circulation, including pulse and blood pressure. Evaluate their level of consciousness and appearance. Are they alert? Do they appear comfortable? Are they able to speak? Do they seem anxious? Persons that are anxious when receiving a vaccination may hyperventilate. Symptoms of hyperventilation include rapid breathing with good air movement, no wheezing or stridor. The patient appears anxious, but not tired or pale. They may complain of lightheadedness. They may have weakness, numbness or a tingling sensation in the arms or mouth. They may have muscle spasms in the hands and feet. To manage hyperventilation, make sure the airway is clear. Instruct the patient to sit or lie down and slow down their breathing. Have the patient breathe into a paper bag to correct the hyperventilation. Provide support and reassurance, and monitor the person until the episode subsides. Symptoms of lightheadedness include fright before the vaccination is given, complaints of feeling faint, dizzy, or tired. The patient appears pale. He or she may be yawning. The pulse is steady, and there is no respiratory distress. To manage lightheadedness, have the patient sit or lie down for the vaccination. Have the patient lie flat or sit with their head between their knees for several minutes. Loosen any tight clothing and maintain an open airway. Check their vital signs, including pulse, blood pressure, and respirations, and apply cool, damp cloths to their face and neck. Symptoms of syncope or fainting may include extreme paleness, sweating, cold hands and feet, nausea, lightheadedness, dizziness, weakness, visual disturbances. Vital signs are normal. The person should be breathing normally. Respirations may be shallow, but there should be no respiratory distress. Pulse is regular. They may fall without loss of consciousness, or they may lose consciousness. To manage fainting, have the patient lie flat or sit with their head between their knees for several minutes. Loosen any tight clothing and maintain an open airway. Check their vital signs, including pulse, blood pressure and respirations. Apply cool, damp cloths to their face and neck. If the patient loses consciousness, examine to determine if an injury is present before attempting to move the patient. Place the patient flat on his or her back, with feet elevated. Call 911 if the patient does not recover immediately, or if an injury is present. Once consciousness is regained, observe the patient in a quiet area until they are asymptomatic, for a minimum of 15 minutes. Severe, life-threatening anaphylactic reactions following vaccination are rare, estimated at about 1 in a million doses. Anaphylactic or allergic reactions may be due either to the vaccine or a vaccine component, and may be severe and life-threatening. The risk of an allergic reaction can be decreased by thorough screening for contraindications and precautions prior to vaccination. However, even with careful screening, reactions may occur. Staff and clinic managers should be familiar with the signs and symptoms of anaphylaxis, because allergic reactions may begin almost immediately after vaccine administration. Anaphylaxis requires rapid recognition and treatment to prevent progression to cardiovascular collapse. Signs and symptoms of anaphylaxis can include but are not limited to generalized hives, itching, erythema or redness, flushing, swollen lips, face, throat, tongue, or uvula, shortness of breath or dyspnea, wheezing and bronchospasm, stridor, hypoxemia, abdominal pain or cramping, vomiting, diarrhea, reduced blood pressure, syncope or fainting, cardiovascular collapse, hypotonia, and incontinence. Every clinic must have an emergency kit containing epinephrine, both autoinjectors and aqueous epinephrine in ampules and/or vials, diphenhydramine, supplies for administering medications, including filter needles for drawing epinephrine from the glass ampules, child and adult blood pressure cuffs, stethoscope, pediatric and adult resuscitators, and other supplies. If a patient has symptoms or signs of anaphylaxis, call 911 immediately. Assess their airway, breathing, circulation, and their appearance and level of consciousness. Place the patient in a recumbent position. Make sure their airway is clear. Use manual resuscitator if necessary. If no pulse, begin CPR. The first and most important therapy in anaphylaxis is epinephrine. There are no contraindications to epinephrine in the setting of anaphylaxis. Each emergency kit will have a pediatric and an adult epinephrine autoinjector that may be used for rapid administration of the initial dose. Administer aqueous epinephrine 1 to 1000 intramuscularly. The dose for epinephrine is 0.01 ml per kilogram per dose. If the weight is known, then dosing by weight is preferred. If the weight is not known or not readily available, a chart included with the standing orders and in the emergency kit has approximate dosages for children, based on age and weight. The maximum dose for children is 0.3 milliliters. The maximum dose for adolescents is 0.5 milliliters. For generalized hives or itching, diphenhydramine may be administered by intramuscular injection at a different site than that given for the epinephrine. The standard dose is 1 to 2 mg per kilogram, with a maximum single dose of 50 mg. If the weight is known, then dosing by weight is preferred. If the weight is not known or not readily available, a chart included with the standing orders and in the emergency kit has approximate dosages for children, based on age and weight. The patient should be monitored closely until EMS arrives. Perform CPR or assist with respiration if necessary. Keep patient in a supine position, flat on their back, unless the patient is having breathing difficulty. If breathing is difficult, the patient's head may be elevated, provided blood pressure is adequate to prevent loss of consciousness. If blood pressure is low, elevate the legs. Monitor vital signs every 5 minutes. If EMS has not arrived and symptoms are still present, administer epinephrine dose intramuscularly every 5 to 15 minutes or more frequently as necessary to control symptoms and maintain blood pressure, up to 2 times after the first dose for the treatment of anaphylaxis. Monitor and record all signs and symptoms, vital signs, medications administered, including the time, dosage, site, response, name of person who administered the medication, and other relevant clinical information. All patients showing signs and symptoms of anaphylaxis, regardless of severity, should be referred to an appropriate medical facility for treatment. If EMS is called, and the student is transported to an emergency facility, the clinic manager must complete the referral to emergency facility form, in addition to the incident adverse event reporting form. When should you complete an incident adverse event reporting form? Fill out the form for any adverse reaction, including lightheadedness, headache, or itching. Any person who was vaccinated twice. Participants with contraindications who received vaccine. Mistaken identity of a participant, when someone received the vaccine using another person's consent form. Document any incident or unusual occurrence. Please include a copy of the consent form, not the original, with the incident report. Please complete all reports on the day of the incident, so that the details are fresh in your mind. But don't feel as if you must complete the incident report during the clinic. It is fine to return to your office to complete the report. If you complete the incident report prior to the end of the vaccination clinic, you may submit the report to the immunization branch with the consent forms. If the report will not reach the immunization branch on the day of the incident, please fax the report to 808-586-8312. Please be aware that incident reports and forms may be read and reviewed by upper management and by agencies and individuals outside of the Department of Health. Please remember, when documenting incidents, be thorough, but succinct. Be specific. Be objective. Be professional. This form includes several common errors that we see on the incident adverse event reporting forms. The form is missing information, such as the student date of birth and the school name. In this example, the patient's blood pressure is very low and there is no documentation of repeat blood pressure checks, or any explanation of the actions taken. The final disposition states, went home with mother, without any documentation of improvement in the patient's condition. In this example, the patient moved during administration of IIV. If a student does not receive a full dose, the parent must be contacted before a second attempt at vaccination is made. This form is marked, Parent contacted, No. In this situation, the parent should have been contacted for permission prior to attempting a repeat dose. Note: the action taken section, including steps taken to prevent recurrence, does not need to be completed if there is no action that could have prevented the incident. Now we will review the procedures for responding to blood-borne pathogen exposures. If a person is exposed to blood-borne pathogens at a school-located influenza immunization clinic, treat the exposure site immediately. Wash needle sticks and cuts with soap and water. Flush splashes to the nose, mouth, or skin with water. Irrigate eyes with clean water, saline, or sterile irrigants. Report any blood-borne pathogen exposure to the clinic manager. Any person exposed to blood-borne pathogens at the school-located clinics should immediately seek medical treatment. Contract personnel should be referred to their employer. Military personnel should be referred to the Department of Defense. Public Health Nursing Branch staff should be referred to the PHN branch. Medical Reserve Corps volunteers should be referred to the MRC coordinator. Kaiser personnel should be referred to their employer. The clinic manager should record the circumstances and post-exposure management on the incident adverse event reporting form. The report should include the date and time of exposure, post-exposure management, details of the procedure being performed, including where and how the exposure occurred. If the exposure is related to a sharp device, include the type and brand of the device, and how, and when, in the course of handling the device, the exposure occurred. Include details of the exposure, describing the route, for example, mucosal, percutaneous, etc., type and amount of fluid or material, and the severity of exposure. Provide details about the exposure source, including the name and parent and guardian's name if the source is under 18 years of age, address and telephone number. List the exposed person's name, address, telephone number, hepatitis B vaccination dates, and vaccine response status. Call the DOH immunization branch to report the exposure. In what situation should a parent be called? If the student has a consent form but states that he or she has already been vaccinated, contact the parent to confirm. If the student pulls away during administration and receives no dose or only a partial dose, contact the parent to ask if they would like you to attempt vaccination again. If you are unable to contact the parent, do not revaccinate. When there are questions left blank on the consent form, if the clinic is very busy, the clinic manager does not need to call for this situation. However, the student should not be vaccinated. If there are contraindications to vaccination, to explain that the student will not be vaccinated. Again, if the clinic is busy, the clinic manager does not need to call in this situation, but the student should not be vaccinated. When the date of the parent or guardian's signature is missing, if the parent or guardian is contacted, document their consent to date the form. Also, parents should be contacted for any adverse event, and anytime a repeat dose is necessary, to request permission to revaccinate. Persons with adverse events post-vaccination at a previous stop flu at school clinic will be listed on a green sheet, which will be packed with the ICS forms. The list will include the names of persons who should not be vaccinated at a stop flu at school clinic, and those who may only be vaccinated with a doctor's note. Thank you for watching this training. If you have questions regarding the content of this training, please email schoolflu.helpdesk@doh.hawaii.gov or call 808-586-8300. Thank you for supporting the Stop Flu at School program.